Hello all, very good morning. In today's class, I would like to continue the guidance and counseling topic. So we have come to the end part of this guidance and counseling. So with this counseling process, we will end this topic guidance and counseling. So in previous classes, I have discussed regarding the definitions, principles, approaches, steps in guidance and counseling, role of a nurse in guidance and counseling, and now we'll discuss regarding the counseling process. So mainly the counseling is given in the view of success. So we are motivating the person, or we are showing a path to the person who is receiving the counseling. Coming to this counseling process, it is a planned and structured, and it is acting as a dialogue between the counselor and the client. So this counseling process is nothing but it is a cooperative process. So here the professional, who means the counselor, is helping the client, nothing but the counselor, to identify what are all their difficulties and what are all their concerns that they are facing currently in their life, and they will try to find out a solution. So this is the counseling process. So if you see here, for example, a student who is admitted in the university or college, so they may be anxiety, they may feel anxious about their study, how to live in the university. So because they have lack of clarity on their education as well as the career direction, so suddenly they are coming to the classroom and we are teaching regarding something which is not at all familiar to them. And if the teacher or if the person who is teaching there is going in a higher note, and if the student is unable to cope up with the class, then they will be very anxious. And sometimes whenever they face the difficulties, they might think that this course is not suitable to us, and why I have come into this kind of situation, why I have let myself into this situation. They will feel and they will depress, and automatically they will deviate from the educational aspect, and they will have a lot of doubts regarding the career direction. So in order to face those type of things, we need this guidance and counseling. And you also have a difficulty with the roommate. So if the roommate is from another race, or if the roommate is from another religion, or the characters are very opposite in direction, in such kind of situations, you will have this fear, so that you need guidance and counseling. And here self-esteem, so self-belief is very important here. So what are all the concerns with your self-esteem also will be seen, and feelings with being pestered out, so difficulties in romantic relationships or so forth. So all these things will come into play whenever you need this guidance and counseling. Coming to the counseling process, so we have steps or we have phases. In step 1, it is the relationship building or establishing relationship process. So it is nothing but the relationship building or establishing a relationship process. So here the step is involving, so mainly focusing upon building a relation between the client as well as the counselor. So here this helps the counseling person to explore the client. So the first interview, it is very important, because the client will observe the counseling person. So as a counselor, you should help the client in reading. You should focus on reading the non-verbal messages, and you should not make any kind of interference whenever he is speaking. So here if you see, in first interview, it is very important, because the client is reading the verbal and non-verbal messages and makes inferences about the counselor and the counseling situation. So he is getting an idea there. So he is assuming himself whether the counseling person who is going to counsel him, whether he is suitable or not, whether he is capable or not. Here the counselor is checking the counselor person. So you need to be very careful in your first interview. So being the face, so you should be adequate with the social skills. So you should introduce yourself, you should listen attentively, and you should remember the client name. And whenever you are addressing him, you should address him with the name, and you should ensure the client and you, both of you, are having the physical comfort. And you should not interrupt the individual whenever they are talking. And you should, as a counseling person, you should observe the verbal communication as well as their non-verbal communication. And nextly, here if you see, for any kind of person, the relationship is not at a peak level when you are introduced first itself. So even though if you want to be friends, you need 2 to 3 meetings, then only you can understand the other person, then you can go for counseling. So in the same way, the relationship is not established in a single session, but it requires several sessions. So here the client is becoming comfortable with you when you have attended several sessions, and when you have met their criteria or priorities, then they will accept you into their whole life. Nextly, we'll discuss regarding the problem assessment. So here the counselor and the client, they are in the process mainly to establish the relationship. So whenever they have established the relationship, the second process will start to begin. So here the second process is nothing but talking. So talking place, what is the problem assessment? So here this step involves the collection and classification of information about the client life, about the situation, and the reasons for what they are seeking the counseling. So here it requires specific skills. So mainly you need to observe, you need to inquire, you need to make association among the facts. You should record whatever the client is saying, and recording of the information should be done systematically and promptly. So all these are the steps that were involved in the problem assessment. So as a counselor, as a person to whom you are going to give counseling, you need to come to a conclusion, means you need to assess the problem. So if you want to assess the problem, you need different types of skills. As we are discussing, observation is needed, inquiry is needed. You should differentiate between what are all the real facts and what are all the fake facts. You should record, you should formulate a particular, you should analyze the things that you have got, and you should make the problem assessment. Nextly, goal setting. So this is the third step. If you compare any other activity, here counseling, it must have focus. So the goals are nothing but they are the results or outcomes to the client. So you want to achieve something in the client at the end of the counseling, so you need to set a goal. So the goal is nothing but the result or the outcome. So if you do not have any kind of proper goal of the outcome is not coming in a proper manner, so you can hear complaints from the both the ends. You can hear the complaint from the counselor as well as you can hear the complaint from the client. So what they are complaining means the counseling session which they are conducting is going nowhere. So here goal setting is very important. This is where the goals play an important role in giving the direction. The goals will change accordingly. So if the outcome is coming in a proper manner, so you might set another goal for the client. So if the goal is not achieving, you have to think about it, you have to rethink about it, and you have to go for this goal setting. So this is the step 3 involved, and step 4 is intervention. So there are different points of view when you are concerning that what a good counselor should do to the clients. So it is depending upon theoretical positions, and it is depending upon the positions that the counselor is subscribing. So for example, the person-centered approach, so it suggests that the counselor gets involved rather than intervenes. So what he is doing by placing the emphasis on the relationship, he is involving rather than intervening. And the behavioral approach attempts the initiate. So these are all some of the interventions. So here you can say the counselor is a good counselor when he is depending upon different types of theoretical positions. So you can follow what kind of theoretical positions that the counselor is using, and you can say whether the person is good or wrong. So as we are discussing, if the counselor is always focusing on person-centered approach, it is saying that he is getting involved. So rather than intervention, means instead of giving interventions, he is getting involved there. So what he is doing is facing an emphasis on the relationship. So here the behavioral approach attempts to initiate. Nextly, the fifth one is evaluation, follow-up, or termination or referral. So here, so for the beginning counselor, it is very difficult to think that terminating the counseling process, because they are more concerned with the beginning of the counseling process. So but all counseling process, they need a successful termination. So the aims towards terminating the counseling process, they will be conducted with the sensitivity with the client that it have to, and any counseling process when it has started, it should have an end. So here the counseling process also should have an end. So here the counselor always, he should be mindful of avoiding the fostering dependency, and he should be aware of own needs. So here if you see the preparation, so to end the preparation, to terminate, the preparation for termination begins long before. So the counselor who is going to counsel, he should prepare the termination process from the long before. Then whenever there is need, he can terminate the counseling process successfully. So it should be an open door, because in future the person might need the counseling again. So at that time that person needs to come. So here the termination, it is considered not just the end of a successful relationship, but it is also considered when it seems counseling is not being helpful. So when it is not like that, when a person is successful in relationship, you should end. Even when the counseling process is not being successful, at those times also you should end. Whether it is successful also you should end, whether it is non-successful also you should end. So in order to terminate this relationship, you need preparation from the long time. And nextly, you should think of this as a means of empowering the client. So here mainly role to review the process, you should create counselor, you should create a closure in the client counselor. So all these are some of the things that were there in the evaluation or follow-up or termination or referral phase. So if the counseling process is not successful, you can refer the case to the other person, or if the counseling process is successful, you should try to keep an termination, and you should keep it as an open door, because the person might need it in the future sections. Coming to the issues of counseling in nursing, if you see in this field, there is always a scarcity. So there is always a scarcity of qualified and competent counselors, and there is a lack of awareness about the needs and resources of counseling. And the other issue is minimal pro counseling environment and lack of counseling training for nurse or nursing faculty. So when a counseling person is not having any kind of training, he might mislead the counseling person also. And poor organizational setup for counseling services, and lack of interest and initiative for counseling services, and poor counselor or counselee ratio, and lack of funds for these counseling services, and non-compliance with counseling interventions, ethical and moral issues. So these are all some of the issues of counseling in the nursing. So nextly, we have managing in the disciplinary problems. So here common disciplinary problems, they are mainly seen in Indian students are like absenteeism. So students will always get absenteeism, and no submission or late submission of assignments, and disturbing classroom atmosphere, threatening strike, damaging or spoiling institutional property, picking quarrels for small matters, and using phones in the classroom, and so on. So these are all some of the disciplinary problems in India. So you need to counsel these type of people so that they can come out of these kind of situations, and we can overcome the process. And nextly, strategies for managing disciplinary problems. So here you need to, if you want to manage these problems, if you want to manage these type of problems, you need appropriate training of the faculty. So you have seen here in issues with counseling of nursing, so here we have a scarcity of qualified component nurses, and also we have lack of awareness about the needs and resources. So all these things will come into the management of disciplinary problems. So here appropriate selection and use of disciplinary standards, use reward and punishment. So whenever a student is doing good thing, you need to reward them, and if a student is doing bad thing, you need to give proper punishment to them. And also we should promote better teacher and student relationship. It should not go into any wrong relationship. And nextly, cultivation of ethical as well as moral and spiritual values, and a close teacher parent student contact should be present, and effective guidance for counseling and guidance programs, it should be done. So these are all some of the strategies for the management of disciplinary problems. So these are the steps that were involved in the counseling process. So as we are discussing the counseling process, it is having counseling different types of phases. First one is relationship building or establishing relationship. This is the initial phase, problem assessment, goal setting, intervention, then evaluation and follow up or termination phase. So these are all the phases, and we have seen regarding issues of counseling in nursing, managing disciplinary problems, and strategies that were involved in the management of disciplinary problems. So thank you. So with this we have completed guidance and counseling topic from your CET. So if you like the content, please like, share and subscribe the channel, and if you have any queries, please let me know so that I can clear your doubts. Thank you so much. Thanks for watching. Please like, share and subscribe.